Hello, I'm Dr. Igor Simonov, and today I will explain how we use the pulse map and Wuxing pulse diagnosis method for treatment according to the Bagua balancing method in acupuncture. So we have the pulse map of the patient who came here with diarrhea and the earache with dizziness. So what we have here, I will remind here the meridians of the lung, heart, spleen, upper pancreas, liver, right and left kidney, and here are the meridians of the full meridians: large intestine, small intestine, stomach, gallbladder, sanjiao, and the urinary bladder. What we can see that Zan meridians, they're practically not affected. Problem is in full meridians. Most of them, we can see that small intestine meridian mostly affected. Has the big deficiency, movement of the wound in this meridian, and the Sanjiao meridian is a big excess movement of the metal, and we see some stagnation also in small intestine meridian. So we will treat these two meridians, small intestine and Sanjiao. According to Bagua balancing method, both and the small intestine and Sanjiao, they hit the same Gua sign, gain. So we will use the gain sign to treat this meridian, this patient. First of all, we will treat Sanjiao meridian, and I will find that we'll say that first the rule which we will use, we will see which level this meridian is with the Zan organ, with the Zan meridian. It is the kidney. So most metal, movement of metal, most yang poles correspond, we'll say, in the balancing method to the most yin, to the kidney. So we will put to the sign gain, we apply, put in the top sign kun of kidney. This hexagram correspond to the metal. Patient came in the autumn, so it's very good. Unfortunately, both of these trigrams, both of these signs separately, each of them correspond to the earth. And according to Wuxing, 5 movements, Xing means the movement to the opposite direction. So it should be 2 directions. So it can be both earth. So we'll need to change this hexagram, and we will choose another one, changing just one line, the part of the kidney meridian, and in this case hexagram is very good working, and it also belongs to the metal. So what we need to do, we need to puncture first point. As we change this hexagram, we correct it. First point of kidney meridian, point of the wound, and as the kidney meridian has the movement of the water, we puncture water point on the opposite side of the earache. Also, we can balance this sign gain with another sign. How we do it? Because actually it is movement of the metal, and we will see what we have here in the movement of metal. And we see here actually it is the heart in the movement of the metal. So what we need to do, we need to use the meridian of the pericardium, and because it's in the movement of the metal, and in the old age in acupuncture text is written that we don't use actually same meridian of the heart, we use the meridian of the pericardium. So this hexagram corresponds to the metal, and it works very well, and we will use just one point, the metal point in the pericardium meridian, opposite to the earache. So another meridian is the small intestine meridian. Also, as I said, it has the sign gain, and it goes on the level with the meridian of the lung. So we will use the sign of the lung. Again, we will need to change it, not the lung meridian, but the small intestine meridian. In this case, hexagram will belongs to the metal. We treat patient in autumn, so we need to use the third point of the small intestine meridian on the same side of the pain, and we will use the lung meridian point of the fire, second point of the lung meridian, and on the opposite side of the pain. And here again we see that actually the small intestine has a movement of the wood, and in the design organs, wood here correspond to the liver. So we'll use the trigram sign of liver, which is the same like the kidney. And again, we need to change it so it will work in the autumn. And we use the first point of the liver, wood point, and we will use the wood point, just because it's not kidney, just we use one wood point on this meridian on the opposite side. So both meridians, small intestine and sanjiao, they actually go through the ear. We use the opposite side for puncturing, for balancing them, and we find that patient found that straight after the acupuncture, first of all, we found that pulse has changed. So sanjiao went down to where it should be, to the movement of the water, and the small intestine went to the movement of the fire. And the earache has disappeared straight away with the dizziness, and the next day patient informed that he has not any diarrhea anymore, no earache, and not dizziness. So it is how we use the pulse map method and 5 movement Wu-Xing acupuncture pulse diagnostic for treatment with the Ba Gua balancing method. Thank you.